Senator Tammy Baldwin is introducing a bill called Hospital Stability and Health Services Act, or HSHS Act.
Now, it deals with hospital closures, similar to the ones here in the Chippewa Valley. WEAU's Alani Claudio spoke with Senator Baldwin today to learn more about this bill.
People in rural areas already struggle with access to health care.
Earlier this year, access to health care was reduced when 2 HSHS hospitals and 19 clinics closed. Senator Baldwin says these closures were a devastating blow to patients, providers, and the local economy. Her bill states these closures should have never happened. Also, the speed of the closings was very abrupt.
I mean, it was just sort of an announcement that nobody was prepared for, and people were just scurrying as best they could to figure out what to do. We're making sure that if a big hospital is going to leave one of our communities, they have to better ensure that workers land on their feet and that their patients still get the care that they need and that no community is left behind.
When speaking about Western Wisconsin, Baldwin had clear goals in making sure a closure this extreme never happens again.
When I heard from folks in the Eau Claire and Chippewa region, they just felt they had no say in this, no ability to have input with HSHS, and that's what led to the chaos. If my bill that I've just introduced had have been law when the closures were announced, the U.S. Department of Health and Human Services could have looked into the closure and asked them to come up with a mitigation plan so that patients could continue to get the care that they needed.
Baldwin's bill will require a 90-day notice to the Department of Health and Human Services and a plan to help staff and patients land on their feet.
If we pass my bill, we can say that what happened in Western Wisconsin shouldn't happen again. And I'm pushing to make sure that it doesn't happen again. And that's why you need sort of a plan, like a mitigation plan. We're not telling them they can't close, but do it planfully. Sudden hospital closures interrupt care and wreak havoc on the community.